Begin. Thank you for joining us today. This is our 8th session of this first series of the Perinatal Mental Health Tele-Echo program for PPCL. I'm Jody West and I'm the coordinator. Just a few housekeeping items. Please put your information in the chat so we can get information to you after the session. This is our agenda. We're going to do our best to stick to this timeline. It goes pretty quickly. So after we make a few announcements and do a few introductions, Dr. Olivier will take over facilitating the program. Jenny Thompson is going to present the didactic today, and then Dr. Amy Reiner Klumberg is going to do the case presentation. We'll open it up for discussion, questions, and then we'll have recommendations at the end. You're welcome to stay on as long as you want. If not, we can get some questions to you if there's additional questions that happen after the case presentation.
Okay.
Okay, well, what we're going to do is I'm going to introduce myself and then I'll turn it over to Dr. Olivier. I am Jody West. I am the program manager for the provider to provider consultation line. And that is a free statewide telehealth consultation program. So we provide support, resources, referral information, training, educational opportunities for providers across the state. So we don't take over the care of the patient, but we help you as the provider find resources that you may need across the state, as well as if you need to talk with our psychiatrist, either perinatal or pediatric, we can connect you. So if you have questions about medication or diagnosis. So this is our QR code. If you scan it, it'll bring you to our website. That's our toll-free number. You can call any time and we'll get any information to you, even if it's just to ask questions about our program. So we'll go ahead and turn it over to Dr. Olivier.
Hey, everybody. Thanks for joining us again. And thank you for anyone new coming to the session. I think I did see some new faces or new names. I'm Dr. Olivier. I'm a child and adolescent and adult psychiatrist over in Lafayette, Louisiana. I'm in private practice at Bloom Mental Wellness, and I am the facilitator for these sessions and the pediatric behavioral sessions. So my job is to make sure that we stick to this schedule as best as possible. But I'm also going to ask our hub team to reintroduce themselves to you. You just met Jody West, our program coordinator. How about Katie Abear?
Hey y'all, I'm Katie Abear. I'm perinatal certified and work in private practice at Bloom Mental Wellness.
Thank you, Katie. How about Dr. Finelli?
Hi, everyone. Juliana Finelli. I'm also a child and adolescent psychiatrist and perinatal psychiatrist at Tulane, and I get to work with the PCL team as one of the perinatal psychiatric consultants.
Thank you. And Dr. Zena?
Good afternoon, everybody. I'm Paula Zena. I am a clinical child psychologist as well as a pediatric nurse, and I'm here as a consultant from a nursing perspective for PPCL.
Thank you, Dr. Zena. So we four are your hub experts, and we will be giving our input into the case later on in this presentation. We can go right into the presentation with Jenny Thompson presenting on engaging doulas. So please introduce yourself to us and take it away.
Yes. So, hey, I'm Jenny Thompson. And thanks for having me. I know we have a variety of care providers on here, so I apologize if maybe I missed something in the presentation, but we can leave that for questions. If y'all have any have anything to add to that, I'm happy to do that. So you can go to the next slide. It's just a little bit about me. I'm a Lamaze educator of about 5 years now, but I've been doing child education for even longer than that. And I've been a doula for over 15 years. I have my undergraduate degree in science from LSU, and then in my former life, I did ocean policy, and I have my master's in policy from the University of Washington in Seattle. And I have 2 kids, 18 and 16, and I'm in Lafayette, Louisiana. So you can go to the next slide. So the outcomes and objectives just for this talk for y'all today is to define a doula and like what they do and their benefits, how doulas work with their clients, and then how we can integrate doulas into like our care system. I kind of focus a little bit more on hospitals, but we can talk about other areas too. And then how to be a doula if you're interested in that, or if you know anybody that's interested in that. So go ahead and go to the next slide. So what is a doula? We are trained professionals who recognize birth as a key life experience. And we support the physical, informational, and emotional support and needs of the parents, and the social needs of the parents too, like any resources that they might need. So I want to emphasize here and be clear about what doulas do and what they don't do. Doulas do offer, we call it PI, the physical, informational, and emotional support for moms and parents, but we also offer parents advocacy, guidance, and referrals to community resources. So these resources oftentimes encompass many spheres, including but not limited to self-care, lactation, healthy parenting, any type of mental health therapy, occupational, etc. Doulas do not perform any clinical or medical tasks such as blood pressure checks, vaginal exams, heart tones. We don't administer medication, and we definitely do not take a place of the partner or any family member. So go ahead and go to the next slide. So here's just some of the benefits and the impacts that doulas have on moms and families. So this information that you see on this slide is, I get a majority of my information from Evidence-Based Birth, and they looked at 26 randomized trials of more than 15,000 women who gave birth with the support of a doula. So overall, doulas aid in decreasing morbidity and mortality for moms and babies. Currently, the rate is for mortality is 12.7 out of 100,000 for white women, and 40.8 out of 100,000 for Black women, which is obviously abysmal. Maternal complications go down around 9.2% with a doula for moms, and the incidence of low birth rate by 6.2%. And babies also had less complications in general when they had a doula. There's also a decrease in C-sections, so there's an increase in normal birth, as well as less use of forceps or vacuums for delivery. C-sections were substantially reduced. Like, for instance, a mom that just goes into labor on her own, her incidence of a C-section goes from 25% all the way down to 13% with a doula. And if the mother needs to be induced or chooses to be induced, the benefit of a doula was even more apparent. It went from 59% for the chance of a C-section all the way down to 13%. So doulas have a huge, huge impact. We also help with breastfeeding initiation. So I'm sure some of you know a little bit about this. Breastfeeding has numerous benefits, including improved bonding, improved regulation of baby's breathing rate and heart rate, and their blood sugar. And then patient satisfaction scores have a direct impact on hospital reimbursements and reported quality of care. And parents report having less negative feelings about childbirth. And hospital staff also report an increase in their satisfaction as well, which I found really surprising, which I just love. There's also a decrease in costs. So the decrease in staff workload, as well as decreases in the rate of primary C-sections, improves outcomes and decreases labor time. So this directly affects the cost of care by an average of almost $1,000 per birth. So overall, the best results for mom and baby occurred when parents had a trained doula. So that means it's not a staff member at the hospital or someone in the mom's social network, like a friend or a family member. Studies also showed that most positive birth experiences are the ones where they have continuous support from a doula and or a midwife. Doula support is risk-free, it's highly effective, and including doulas as part of the care team is really critical, not just because they improve health outcomes, obviously, but also because they provide all that support to families. So you can go ahead and go to the next slide. So this is generally how doulas work with clients. A lot of people just want to know, like, well, how in the world do I find a doula? So most families find a doula, but by just doing like a quick Google search or word of mouth, then or maybe through one of y'all. So we'll talk about that in a minute. But then they usually meet up, whether it's virtual or on the phone or in person, just to see if they're a good fit for each other. And then after the family hires the doula. They do 2 prenatals. Generally, they're about an hour long each. And then she provides labor support. So that could be labor support at home before they go to the hospital, or they might agree to just meet up at the hospital, depending on how the birth goes. And then she stays for about an hour or 2 after the birth to help with initiating breastfeeding and make sure that everybody's just kind of good and safe and tucked in and have all their questions answered by the staff. And then the doula leaves and usually makes a visit within the next week, typically at the parent's home, but not always. Sometimes they meet up at the doctor's office or the midwife's office to do a postpartum visit and answer any questions that they might have. They might do like a birth debrief to see what they thought about it. So um, sometimes the doulas can, get a feel if mom is not doing so well at that postpartum visit. And that's usually like a really good chance for us to recommend a therapist or somebody that they can talk to. So that's one place where maybe doulas can work with y'all. So you can go to the next slide. Here is some other things that doulas do, typically more like at the birthplace itself. Lots of communication. So they help to bridge the gaps and act as facilitators to help mom and partner with the hospital team. We help to clarify medical information and jargon and procedures. And we also help connect them with resources outside of the hospital if they need, like mental health therapists, physical therapists, lactation, etc. And then we coordinate with staff during the birth. So ideally, this is what we want, but it's not always what happens. Ideally, we would love to just kind of huddle with the staff on a plan of care for the mom while she's at the hospital. And sometimes that happens, and it's really fun because we get to exchange ideas on position changes or things that can help mom and dad maybe lower their anxiety, anything that just can like help them through the whole birthing process. And then we provide emotional support for the family and the mother, obviously. So we help to ease stress, decrease anxiety and fears, and be a continuous presence, as well as provide non-clinical emotional support and reassurance. So you can go ahead and go to the next slide. And then we help advocate. So we help advocate for moms as best they can, and also teach the family and the mom to advocate for themselves as well. So doulas respect the family's birth preferences. They help articulate their birth plan and ensure mom's preferences are being heard by the hospital staff. So I want to stop here again and say that doulas do not project our own birth preferences on the family. Many times, some providers think that doulas are on a mission for natural birth, when really doulas just want the family to have an empowered birth where they feel a little more in control of their decisions and how their birth goes. And then informed decision making. So we help empower clients with the information that they need so they can make confident choices for their individual family. And you'll see up there to the upper right, I put brain. So we typically talk about this a lot with our moms. The benefits, the risks, the alternatives, what does their intuition tell them to do? And if they need more time to think or make a decision, they can discuss that with their care provider. And then we encourage their partners too to participate in the birth. So it doesn't matter if it's a grandma or sister or spouse or partner, husband, whatever. We want them to participate. So doulas involve the partners. We don't replace them. We see the mom and the partner and the baby as like a single unit together. And we encourage the partner to participate in the birth process, as well as to provide guidance and reassurance to the partner and their family. And doulas essentially help to inform the family on how to best support the mom in pregnancy and in labor and in postpartum. So we kind of give them some ideas, which is really great. You can go to the next slide. So, and then let's talk about integrating doulas. So this is just a list. I'm going to talk more about this in the next slide. So orientation for doulas in the hospital, educating providers and staff on how doulas can help, defining roles by both parties, increasing access to doulas, and then partnering with local organizations. So you can go to the next slide where I kind of discuss them a little bit more. So, okay, number one, orientation. So, and I guess like this could be helpful, not just like for doulas working in the hospital system, but if there's any other care provider, mental health therapist or whatever, this would be great too. Showing them around the floor, introducing them to staff, general housekeeping, like where the snacks are, pillows, towels, extra bathrooms for not just the doula, but for other family members. This is a really easy one that can establish mutual communication and trust, like amongst everybody. And then number two, educating staff. So ask the doulas on how they can help your patients and how they can collaborate with providers and staff. This generally leads to a discussion about the doula model of care, which is the physical and informational and emotional support. And this is where where we want staff to know that we are there to help not just the providers, but the patients too. We are not there to hinder the staff. In fact, we like to say that we create repeat customers because when the mother has a great experience, she tends to keep going back to that hospital. And to also remember, I would love it if hospitals would start teaching more or training more of their staff on trauma informed care. Y'all probably know a lot about that. Many women have traumatic birth experiences in the hospital, and I've seen different numbers, but I guess it's hovering around like 1/3 of moms have what they consider a traumatic experience in the hospital. So it would be great if we could start to focus on that. And then number three, defining roles. So allowing time for doulas to explain what they do and not do, allow time for questions like from the doula to the staff, get in deeper about what what they do and don't do. Some doulas have like a scope of practice that they work by. And I want to say that it's important to remember that although doulas help to advocate, that doulas also respect clinical boundaries, not just for hospital staff, but obviously for therapists. And we have a saying, like I am a volunteer doula coordinator for Mary's Hands Doula Network. And we have a saying that says drama brings the trauma. So like in other words, if the mama, and the partner are happy with the way that things are going, like even if we're aware that there's some type of wrongdoing, like it could be like the littlest thing, like maybe they're rubbing baby too hard, or maybe it's just, sometimes we obviously say something is not going well. A lot of times we just leave it alone. We don't want to disrupt those good bonding hormones that mom and partner and baby are having. We only provide like physical informational and educational support. And we just during that time, we're encouraging mom to like communicate with the staff about any questions she might have or any concerns, and that we're not projecting anything onto like that moment. So number four, increasing access to doulas. So encourage your moms to get a doula. There are so many organizations and individuals out there who are willing to work for free or reduced rates and can actually help the underinsured and uninsured get access to doulas. There's literally a doula for almost every type of family and every type of community now. Some of y'all may know that Medicaid and private reimbursement is coming for doulas too, which I think is great. And we currently have a doula registry board that hopefully will create more access to this type of care. And then partnering, number five, starting with local doula organizations. This can happen several ways, but it helps to create a referral network of doulas in your area. I'm going to show some examples on the next slide. So go ahead and go to the next slide. So here are some of, just a sample of some of the organizations that are more local to our state working towards increasing access to doulas and to training doulas. This is definitely not everybody that's involved in this in the state. I apologize if I left anybody out, but I wanted to point out that Community Birth Companion, Mary's Hands Network, Best Doula, System Midwife are several organizations working very hard to decrease the barriers to entry for people who want to be doulas, particularly Black doulas. And you can go to the next slide. And then this is just how to be a doula. I'm focusing more on our local organizations here because having these local trainings decreases the barriers to entry for anybody who wants to become a doula. So again, Mary's Hands Network, the Community Birth Companion, System Midwife, and Best. You know, if you want to be a doula, or if you know anybody that wants to be a doula, they just need three things: be like passionate to serve women and babies, be able to just be open-minded and to be able to learn and to grow and to maybe change the way they think a little bit, and to also continue to train and to network with other doulas. So just those three things make for a great doula. So that's it. I'm sorry, I went a touch over, but if y'all have any questions, I'm willing to.
You didn't go over. We have a couple minutes for questions.
Oh, good. Yeah, I don't know if.
A big thing that I will hear is that there's a perception that doulas are expensive. So
Mhm.
I think it's great to hear that maybe this is something that they can look into to get support, even if they feel financially that that's almost like a luxury
Mhm.
item to have this doula. You know, it's kind of painted that way. What do you tell people who feel that way? And do you hear that often?
I hear it often because, like, just in the recent past, most doulas charged money. We've like had to charge money. And now that people are starting to realize how we can benefit birthing women, it's just becoming more accessible. There's more grant money going towards organizations like Divine's group and our group and System Midwife and all of that, to where we can like decrease those costs. And it's really nice. I think Louisiana is one of the first states to have Medicaid reimbursement. So although it's like not, ideal, but like if, I mean, it's great. We can get doulas out there for like little to zero cost. In fact, Mary's Hands Doula Network, we have that running right now in Lafayette. We just had a birth last night, but we're already serving moms for free in our area, which has been awesome. And they're also in Baton Rouge, and I think they just did a training in New Orleans. But again, we're not the only ones doing it. There's other groups doing it, which is awesome. So just y'all just let people know that they can get a doula for free or reduced cost.
Looks like Paula has a question.
Yeah, I'm wondering if doulas need any kind of special approval to be in a hospital setting.
Not right now. I do anticipate that might be coming maybe in a few years, but not yet. There are some hospitals that maybe, I think I've heard, okay, this is might just be hearsay, but I think like Women's in Baton Rouge maybe has like an approved list of doulas, but I think other independent doulas can still go in, but they have like, I guess, a list of like doulas they, I guess, have kind of vetted a little bit. Um, so I do see that coming. I think once the Louisiana, I think it's LA through LAPQC, I guess, is doing the doula registry board. Once we maybe have that listing, I think that will probably eventually start the ball rolling for that. I'm not quite sure how I feel about it just yet, but I feel like I see it coming.
Well, thank you so much, Jenny. That was great.
Yes, awesome.
We are all right, y'all. Thank y'all so much for all the recommendations and the presentations from Jenny and from Dr. Renner Klomberg. Really appreciate y'all.
So go ahead, and if you haven't already, we did put the survey link in the chat. So if you want to obtain CEUs or CMEs, our next session is scheduled for Tuesday, October 22nd. And the topic is substance use during pregnancy, and Dr. Mishka Turpin is going to present. So we look forward to seeing everybody then. We'll stay on for a few minutes if anyone has any questions, but if not, hope to see y'all in October. And have a good rest of your day.